So, what are some important things to know as a person who has glaucoma? Hi, I'm Dr. Nagoria. I am an ophthalmologist and a glaucoma specialist. And today I want to talk to you about the five most important things to know as someone who has glaucoma. The first most important thing to do is take your medication. So, if you are on eye drops for glaucoma, it is really, really important to take those medications as prescribed. Poor compliance with glaucoma medication is a cause for the disease progressing. And when the disease progresses, it does result in irreversible vision loss. So once the vision is gone, we cannot bring it back. Even if your pressure is good in the office, if you're not taking your drops regularly, that means the pressure could be spiking at home. And every time that pressure spikes at home, you could be having small amounts of damage to your optic nerve. So, really, really important to stay compliant with your drops. If you can't remember to take your drops, try setting an alarm, try engaging a member of your family to help you. And you also have to make sure that the eye drops are actually getting in your eye. If you're not sure that they're getting in your eye, have someone watch you, or the next time you're at the eye doctor, have your eye doctor watch you while you put the drops in. Number two, see your eye doctor at the recommended intervals. I know things can get busy and sometimes you have to miss an appointment, but if you miss an appointment, be sure to reschedule as soon as possible. Your eye doctor has you on a certain schedule of appointments according to how bad your disease is. And sometimes you may need to have your management changed. If there's some abnormality on your testing, they may want to see you more frequently. So it's really, really important to stay compliant with not just your eye drops, but also with your eye care appointments with your ophthalmologist. Number three, the visual field test. I know this test is really annoying and it takes a while to take and it's tedious and you have to do it almost every single time you come in, but it is a really important test. So it's important to pay attention during it. That's my third piece of advice is really try your best to pay attention. The reason it's so important to pay attention during the visual field test is because it will give us good data. If the test is unreliable, then the ophthalmologist may not be sure if your glaucoma is progressing or staying stable. And that's obviously very important because if it is progressing at your current medication level, we may need to do something else. We may need to add medication. We may need to do a laser. There are other things that we may need to do to help us keep your glaucoma under control. So taking that visual field test is pretty important, and doing a good job, meaning paying attention when you're doing it, is also really important. Number four, plan ahead for medication refills. I can't tell you how many times a patient has come into my office and their pressure is out of control and they tell me, I ran out of my medication. I really, really encourage you to plan ahead for your refills. Try to figure out, if there's not too much left in your bottle, call your doctor's office, call your pharmacy. Many doctor's offices will often give you many refills on your glaucoma medication, so you may have a refill waiting for you at the pharmacy. But of course, it can take pharmacies 24 hours to fill prescriptions, so try to get ahead of that so when you come in, your pressure has not been out of control for the last few days. So really do your best. I know glaucoma is a lot. It's a chronic eye disease, and the medications involved can be overwhelming. So do your best to plan ahead for those refills so that you're not running out of medication and your pressure is not spiking before you get your new refill. Number five, make sure you get your family tested for glaucoma. There is an increased risk of glaucoma in anyone who has a first-degree relative with glaucoma. So this means if you have siblings, they should be tested, and if you have children, they should be tested. Obviously, your parents should also be tested because older age is also a risk factor for glaucoma. It is not 100% certain that they will have it, but getting tested is non-invasive. It just requires some of your time and a doctor's visit. Hope you found this video helpful. Please support the channel by liking and subscribing below. And if there's anything else that I can talk to you about glaucoma, please leave a question in the comments below and I'll try to do a future video on it. Thanks for watching.